So we run an integrated service model, so we've got quite a few services. So we have an intake crisis counselling service, which is the centre of the whole of Macarthur. So everything comes in through that and is fed out through the central intake service. We have a women's health counselling service, education in groups. We have therapeutic childcare, child and adolescent and youth programs, some of those under domestic violence and some for mental health for young people. We have a staying home leaving violence service, which is an intensive case management program. And then we have our Foundations for Young Parents, which supports young parents with children. And we have some targeted early intervention supported play groups and transition to school programs and some community-based programs. I think because we work as an integrated service model, I think that's quite unique. So even though we've got 3 different types of funders and all the different work, we do work together. So what happens for women is when they come in, one of the things we've really worked hard for is that women don't have to retell their story. One of the things we hear women say to us is, I don't want to tell my story again. I've already spoken to 4 people and nothing's happened, so they lose faith in the system. I think one of the things we've really tried to do here with the integrated service model is that women don't have to do that. So they tell their story, we record it, and we have access to that. So we can go in and just say, this is what we know so far, can you correct us? Where are the gaps? We can just collect the gaps of information that we need to rather than the whole of stories. What that means for a woman, for example, is that a woman might be engaged, they come through intake, and once intake has done that initial crisis work, then they may come through to women's health. They might be referred to women's health. Once a woman has started to do their own counselling and have some capacity, they may then make a referral for her children to child, youth and family. But they may also be working with staying home leaving violence if they're in that crisis component of getting upgrades done, or there's ongoing court. So staying home leaving violence would support that court process and see that out with a woman. So I think having an integrated service model is really important. And that means that that woman's not retelling her story. And what we also do there is when we do a review with a client, we do a joint review. So they only do that once and all the workers are in the room that need to be in the room, and then the woman doesn't have to go and tell this worker that they're up to, my counsellor's doing this, my caseworker's doing that, so it's all integrated together.